Dr. Paul Ruff at West End Plastic Surgery, and today we're going to talk a little bit about hand rejuvenation. It's interesting because hand rejuvenation is one of these things that doesn't often get talked about openly, but apparently is a thing of interest, particularly for women. We do a lot of facial surgery here, facial rejuvenation, and we find that the hands are oftentimes exactly what gives away one's age. And so now there is a hyaluronic acid. It's the first FDA-approved hyaluronic acid for hand rejuvenation. And we do hand rejuvenation with a lot of different modalities. We can treat the skin surface with either chemical peels or IPL to get the brown spots away. There are topical agents that can help with the surface hydration of the skin, but probably one of the biggest things is the volume depletion that happens with age, the appearance of the lines, the tissue turgor, and even the veins, and you can start to see the tendinous areas. Hand rejuvenation is usually graded as a 0 to 4, 4 being the worst, a 0 being a nice teenager or early 20-something hand. Most of our 30s, 40s, 50s, 60-year-olds will have somewhere between a grade 2.5 to about a 4. This is a pretty straightforward procedure. It can be done under a little bit of local anesthesia, some topical for those who are a little skittish about the whole thing, but most patients don't require any anesthesia and there's very limited downtime to it. Always a potential for some swelling, so we don't recommend that anybody does anything super vigorous like plays tennis or golf or goes and weight lifts for 24 to 48 hours afterwards. But your normal day-to-day routine is fine. It is a needle. It can also be done as a cannula, and we're going to see both today. There is a potential for some bruising, but that typically usually is minimal as well. There is a very specific plane in which this is to go so that it can spread properly, as well as create that rejuvenating fullness, that youthful fullness that we want to see in someone's hands. So here we go. We're going to go a little bit about the anatomy. So we can see where the wrist creases are. And we can see where her tendons are. And so we want to go between these areas. So for this first one, we're going to prep with alcohol. We've already done a little bit of a prep at first. The alcohol also helps us see the veins. It helps them pop up just a little bit. Same thing over here. So we're going to start over, and how people start this really doesn't matter whether you start towards the wrist or whether you start up towards the fingers. It's more about the deficiencies. So she's got a little bit more deficiency here, a little bit up on this place. So we're going to come up and get tented up just a little bit. We're going to go just in. We're going to put a little bit of product right in this very nice space. And when you're right in the right space, it does tend to start to fill very nicely. A nice slow injection. We're going to come back behind that just a little bit right here, a little pinch, a little tiny bit more product. The other nice thing is if we're in the right plane, it tends to be not too uncomfortable. So I'm going to go to the next inner space. And if we're in the right plane, we're actually above the plane where the blood vessels exist. So it helps minimize the appearance of those. Pinch. And most hands take anywhere from 1 to 1.5 cc's of volume to ultimately rejuvenate those areas. Pinch. And whether we do 3 or 4 little boluses and massage those out, or whether we do a whole bunch of little tiny micro ones throughout the area, is really individual to individual. Right here, pinch. So when you're in the right plane, it just starts to open up into those areas. The other nice thing about this is there's a little bit of local anesthesia in the product. So it does help with that as well. Pinch. here just a touch. We're going to come right here, pinch. On this hand, we're going to do with the cannula, which is right here. It's a blunt tube. It does not have a needle. It requires 2 small insertion points. So we're going to get that ready to go right now. All right, so we've numbed up 1, 2, 3 little potential injection port sites. And so this is our cannula. There's a needle. We use this to make the port. This is the cannula. Remember, it's a blunt tipped cannula. It has a little direction indicator that's hard to see. It's the little black dot right there, so I always know where the output port for the cannula is. So we're going to start. I'm going to make one little port site right here. I like to spin the needle just a little bit. Get things started a little bit in either direction, and then we're going to make the second one right over here. There are 5 little layers to the back of the hand. We want to be between that first or in that second layer, between that first and second layer, or right in that second layer. All right, so we always prime this just a little bit. We're going to start. We're going to come right in. We're going to get right into that space. And if we're right in the right space, it'll be very comfortable for the patient. It's not a space that has a tremendous amount of nerves in it. Sometimes we can tent up just a little bit. So we're going to do right between these tendon spaces. That is the nice thing about this, that this has usually very little bruising to it. Come over to this other side. And as I stated earlier, there is lidocaine in here. So this does go numb as we move through this process. I'm going to cross over this way just a touch. And you can see how superficial it is. We want to be in that very superficial layer. Distributing the product uniformly. And then the last thing we're going to do is a little massage on both hands for about 2 minutes. So we're going to take it and massage this really uniformly. The product characteristics of Restylane Lyft allow it to be easily distributed within that layer pretty firmly. And if we do this totally for about 1 to 2 minutes per hand, she will have a beautifully even result with hyaluronic acid, which is a naturally occurring substance that is usually the gel between our cells. It helps with the hydration. And this should give her beautiful hand rejuvenation for the better part of a year and possibly beyond. We oftentimes recommend retouching this somewhere around 12 weeks and seem to get a little bit better longevity with that. That's one side. So this was the bolus technique, so we're going to do a little bit of more massaging here to get these little boluses evened out. If someone was having another procedure like a liposuction or a facelift where we're doing harvesting of fat and fat grafting. Oftentimes I'll use fat in these situations, but as an off-the-shelf, reliable, consistent, safe, and predictable hand rejuvenation option, this is definitely fantastic. So that was just 1 cc per hand. We can go up to 3 cc's per hand, and once again do a retouch in a few weeks. But as someone who is coming in wanting their hands to look better, look a little bit more youthful, look more consistent with themselves or their personality, this is a great option. So this is Dr. Paul Ruff at West End Plastic Surgery, and I look forward to seeing you with your hands.